He bites. Do you have snoring?
No.
You have. Is it serious or mild? How do you rate it?
I moderated, little above mine.
Okay, because your face is suggested that you could have that. I'll have a look at the scan again so we have more clarity on that. Can you smile for me? No, you have to be tight as well, right? Now, is bite a concern for you, or is it okay if I keep the same bite?
What would you suggest?
See, the main concern for you is the facial balance. So the lip is incompetent, the chin is back, and all mid face, and we have to do a like a bijaw, counterclockwise, upper jaw, lower jaw will come forward, both of the mandible, chin, and so you get a good balance. That's the main thing. If you want us to look at the bite, I can look at that also at the same time. But the one issue is, because you've already had orthodontics done, you've already had treatment for that, what generally tends to happen is that these teeth, repeatedly, we are moving it back and forth. We might need braces again or some form of dental alignment.
Okay.
Could be braces or could be aligners. So then what tends to happen is you're moving it again in another direction or in the same direction, whatever. So it's not desirable to do that with teeth every few years.
Okay.
So that is why I would, if you were for a fresh case, I would not ask you this question. I will do it. But because you've already had a proper orthodontics with many things, and therefore I would think the better option is to deepen your bite. Though you have a problem with your bite, which they should have rectified when they had done the treatment, especially because they've done an extensive treatment for you.
By the way, it's a 1.5 year treatment, but it's 7 years back.
Or whatever.
Yeah.
So they have removed teeth and done for 1.5 years treatment, an extensive full-blown orthodontic treatment, which should have given you the ideal bite, and you do not have one. You still are having an anterior deep bite, which is not a perfect bite. Now, to correct that surgically is possible, but again we'll need braces in a lot of patients later on. So that is something I don't like to do because you already had done a major thing and they've not done a good job, and then your teeth are now not as strong as it should have been. Would be. So we can let the bite be the same.
Okay.
As long as, because see, this anterior deep bite, it doesn't cause a big issue for patients. When you smile, I know something is wrong, his teeth is down, something like that. But other than that, it's not a big concern, right?
Yes, not really.
So then that's what I want to do. So rest all I can take care. The other thing is, I could do Geo of course with Bijaw, or we probably will not do Rhino for you. 2 reasons.
Okay.
I'll show you the scan. I will do what is called as a septoplasty and piriformoplasty.
I just basically wanted it straightened and a little narrowed on the top.
I'll explain what I'm going to do though. So septoplasty is working on the septum that is in between the nose.
Okay.
And piriformoplasty is working on the sides of the bone of the nose.
Okay.
Both of this I'll be doing when I'm doing the jaw surgeries and everything.
Okay.
Hence, I would not want, or I think there would not be a need in your case to do a full-blown nose job.
Yeah.
Once this is done, this comes part of the face makeover already.
Okay.
So you will not need to do a nose job, or most people will not need a nose job. And if you do need a nose job, we can consider that separately 6 months or 4 months after the surgery. And 8 out of 10 patients will not need it. Because we already looked at the nose, I already addressed the nose while we do all of this. Okay. So this is what I wanted to understand. So even though we're not going to be technically doing a rhinoplasty, you're not going to be charged for that. But when you do the Bijaw Geo, I'm going to work on the septum and like a face makeover. So all of that is included.
Yes.
And so therefore we will still, and that also gives you the option of doing a rhinoplasty if you so desire a few months later or a few years later.
Yep.
So there will be no scar, nothing. You will not touch it. All will be done from inside the upper jaw. When I get the jaw now. Okay.
I mean, I did look at the structure earlier myself also, but I thought let me consult a specialist with my thoughts. Because it might not be possible. But
Since you have snoring issues, this will be corrective for you. We can take care of all of those snoring issues also for you. Can you open your mouth and say ha? Open your mouth and say ha. Can you tell forward, please? Yeah. Oh, you extracted your lower first premolars as well.
no, both on the top and the
removed. See, this is one of the reasons why you're also getting snoring. You're an engineer, probably can understand spaces. Imagine this is your space.
Okay.
Tongue is sitting inside.
Okay.
Behind the tongue, what is there? Airway.
Okay.
Which you breathe. Here, doing 4 teeth are removed and closing. What goes back along with your teeth? Tongue. Tongue space is reducing. Tongue space is reducing. Where does the tongue go? Tongue is not going to get atrophied. It's not going to get shrunk. Tongue is going to move back. It's going to move back significantly because you see this man will pulling 4 teeth across. They've done not done a good job. They retracted it unnecessarily too much. So by doing that, they're pushing the tongue back and pushing the tongue back, they're causing the sleep problem for you.
Yes. I guess even that guy was aware of it. He told me that then what he tried to do is try to pull it forward. Basically, it didn't work.
That they can't do. They cannot with dental techniques pull the teeth forward as effectively as pulling it back.
They had some type of a machine, like a small type of machine that you put it there.
But still,
it won't work.
It doesn't work as effectively as retracting.
Of course.
Retracting and moving the teeth sidewise work better than pushing it outside. I'm just trying to give you the understanding of what is happening in your case. And so you have to understand because had you not done it, your sleep problem wouldn't have been there. I'll show you in the scan here. Okay, so you see the tongue starts here. That's your tongue. So you keep on reducing the space. Of course, this will keep going back, and then you want this more. This is your thing for breathing. So this is the area from the nose. This is the area from the mouth. Your area from the nose is quite clear. The area from the mouth is not clear. Because what has happened, they've taken it back. The tongue is going up also. And up what is there? Uvula is there. Another soft tissue is there. If it goes up and back, there's no space for you to breathe. It's okay to breathe through the nose. That's what we normally do. But when we sleep, the tongue, if it falls back, it's a common passage here, which the tongue comes in the way. Okay. Understood what's happening here? So this is why these kind of treatments, a lot of the dentists who do this do not understand, unfortunately. These are the whole dynamics of the face and how it works. So when a patient comes and if you're only looking at the teeth and if you're only saying I need to retract the teeth because the teeth is sticking out and then you'll end up with a sleep problem. In some patients, this is not a universal rule. For a lot of them, this doesn't happen. As long as you have a problem with the dentoalveolar proclination, then this is the best thing to do. But if you have a normal dentoalveolar proclination and you're trying to correct the patient aesthetics by doing something, then it will cause another bigger problem in your like what has happened. So just for you to understand the whole mechanics, and therefore I don't want to touch your teeth again with orthodontics. So that is why I'm saying I will move the full complex. But now what will happen? This will rotate down. So this point will come here. This will rotate down and move forward. So this point will come here. So imagine the space that you are taking here. And when we do that, what will also happen? Jaw length will increase, chin will increase, this will close, this will come in, everything will get corrected. That sounds good. Exactly. So in your case is a classical case where the problem has been, well, if not created, has been exaggerated significantly. And now we're going to do a surgical procedure to not only correct that, but also give you a better profile. You were a surgical case in the start itself. So had the braces not done in your case and just the surgery done, it would have been a much simpler surgery and would not have led to any of your sleep problems. Just so that you understand the issues that has happened to you.
Okay. Actually, even when earlier I did the thing right, the orthodontic, I was actually kind of a designer, so I told him take the side view of the skull and see.
So you have to understand, not decide. You. I'm trying to make it as simple as I
No,
can.
I mean, he doesn't have that machine to see this scan, so don't take a side and check it if it's really refined.
No, they're not dealing with it. You can't blame them. It's the issues with
I mean, yeah, back then technology
Yeah, that
was
was also.
clipped, right? It's not as
Sometimes I do.
it's not his fault also.
I wouldn't say anybody's fault. I'm not
Just
just the
happened,
fault
yeah.
game. I'm making you understand the anatomical changes that have happened, why it has happened in your case. It's so classical. If it's not so classical and so clear, I do not go about explaining it. Because it's a classical case, I just thought you should understand. Then
And so that's why I thought I'd take your opinion because you are the expert, you know what is,
yeah, so
actually possible.
this will be taken care of. You would need a Bijaw with genioplasty and everything will be settled. We're not going to take care of your bite. How many millimeters of movements, what type of counterclockwise movement or clockwise movement or blah blah blah, everything. We will plan once you say okay for surgery. Irrespective of the movements we do, irrespective of the rotations or yaw and roll or whatever we do with your jaws, costing remains the same. For all the procedures we use German titanium plates and screws, which are like the best in the business.
Okay.
And the costing also includes your stay, ICU, everything, and also includes the workup. This is not the workup. This is just this is the investigation, the basic thing.
Yep.
The workup we will do will include that as well. Alright? So no. So you can talk to my executive. They will give you a precise understanding of the costing. You have to stay with us for anywhere between 7 to 10 days. Whenever you want the surgery. So that's it, and I would require it to have a clean shape at that time when we planning the surgery.
Okay, so will the surgery be done if I say okay?
If you say okay today, we can do it tomorrow, or we can do it on Saturday. Or we can do it on Monday. This is the earliest we can work. If you say okay tomorrow, we can definitely do it on Monday. We need 24 hours of working time.
Okay.
Because this is only the, as I said, the first scan. Then we do what is called as 3D planning and 3D printing. We have a software on the computer where they will plan everything, design your face, and then experience the 3D printer.
Okay.
Then that is taken for surgery. The costing includes that, but we do that only after you say yes.
Okay.
So that's the back end work of many hours for my team after that. So just get them. You've got the understanding of your concern, how we need to sort it out. You get very good result.
Okay.
I mean, your face is going to look superb, and also your sleep, all that will go away.
Okay.
Will not be an issue after 1 month after surgery. You will not have a problem.
Okay.
Talk to my staff and understand about when you want to get it done, and we can plan accordingly.
Okay.
Okay. Sure. See you. Welcome.